Welcome to Collab Conversations with the American Diabetes Association and Beyond Type 1. My name is Ginger Vieira, and with me today is Dr. Nuha El Sayed. She is Vice President of Healthcare Improvement at the ADA, and we're going to talk about protecting your toes, feet, and legs from amputation as people with type 2 diabetes.
Thank you for having me.
People don't necessarily realize how common amputation is in those with type 2 diabetes. Can you tell me a little bit about just how huge this is?
So amputation, is really a devastating disease. And, unfortunately, during COVID, there has been indications that, during lockdown that, risk factors and people not being seen, our nation has seen, a slight rise in amputations, which is really, disheartening. But I mean, we're very happy that we're back to some kind of normal. And now people are seeing their healthcare teams and things are coming back to where they need to go.
Okay.
So I have a whole list for you of, who's at increased risk for amputations.
Let's hear
so
it.
One is, people who have high glucose values, and as you can see, I mean, that's a huge percent of our population. Smoking is a big problem. People who have neuropathy, which is nerve damage. If you have calluses or corns or foot deformities, all of these put you at much higher risk. Poor circulation is a big one. History of having a prior foot ulcer puts you at very high risk. So, I mean, these are some of the things. I mean, kidney disease, high blood pressure, high cholesterol. So as you can see, there are a lot of risk factors, many of which are completely manageable, and we can stop before we get there.
Okay. And I believe one of the most common kind of pathways to unfortunately needing an amputation is when something as simple as a cut or a blister becomes an ulcer, isn't healing, and then becomes further infected, which high blood sugars can feed that infection.
Absolutely. You're describing a very poor scenario. Yes.
Okay.
And if you think it can be, yes. And if you add neuropathy to it, like you didn't, like I've had recently a patient and he has neuropathy. So he did have an ulcer. Like he had a blister that turned into an ulcer. He didn't know, except like, after he didn't feel it.
Right.
And so that's why, our counseling for people who have neuropathy to, since you don't have the power of the nerves to tell you there's something happening, use your eyes, use mirrors, use your significant others,
right. Daily, right? I mean, daily.
Absolutely daily. Yes.
It sounds so probably crazy to somebody who has neuropathy and hasn't experienced an ulcer that a simple cut could lead to an amputation, but it's an
highly preventable. Highly preventable. You see it. It's at the very beginning. Very early on. Sometimes it's just local antibiotics. Keep it clean. Work with your podiatrist. Nothing will come out of it. But if you let it sit, then problems can arise.
Right. If you ignore it and hope it's nobody.
Yeah, absolutely.
So preventing and protecting your toes, feet, and legs from amputation starts with, as you talked about, all of the risk factors, working with your healthcare team to lower your blood sugars and other aspects of regular health. Checking your toes and feet daily with support from a loved one if you need to, and mirrors, and seriously daily.
And good light.
And good light.
Yeah.
Right. Especially and definitely if you have neuropathy and cannot feel your feet.
Yes. Washing them daily.
Okay.
Keeping them dry. I tell my patient not to go barefoot. That's a bad idea.
Right.
There are, if you have calluses or corns, like don't buy home-based interventions and kits from pharmacies. Just go to the podiatrist. They're far more trained than you are to take care of them. And it should be, a short visit. Things, and as I mentioned, don't smoke. Make sure you buy the right kind of shoes.
Right. Shoes and socks, right? You don't need fancy diabetic socks, but even just changing your socks partway through the day so that you're not in sweaty, damp socks.
Absolutely, absolutely. The right, I mean, you know, nice cotton socks, you know, and you'll have a ton of recommendations from your healthcare team. For some people, like, you know, there are a lot of good shoes out there. They don't all look ugly. You know, get some of these, and you can get recommendations from a lot of places now for that. I think the podiatrists tend to be your best bet. And you know, we do not want something that fits too tight, that's not deep, that's not wide. And you know, people should be fine. Absolutely. And when you go to your physician, don't wait for them to, or actually healthcare team, not just physician, don't wait for them to ask, you know, about your feet. Take off. I tell my patients that just take off your socks and shoes and have them take a look.
And there's so many steps between if you have an ulcer that isn't healing or an infection and an amputation, if you go in and tell people that you need help and get the treatment that you need.
Absolutely. Absolutely. We have excellent wound care. We have excellent podiatrists. And the approach and mentality is very conservative. Like, you know, so make sure we do everything we can to get the skin to close back up, and then actually to prevent in the future. Say, for example, some people walk in different ways. You know, if you're a runner and you understand, some people like to, you know, walk, and you know, and what podiatrists do is they look at the pressure points and create the right type of pressure. Or if you need to be off your foot, they'll tell you it will heal, and we don't have to go down that route.
Okay. So podiatrist is huge if you're having
It is absolutely, and you know, we are lucky here in the US that we have them.
Cool. Well, thank you so much for helping open our
You're
eyes
welcome.
about our feet.
You're welcome. There's so much we can do to prevent amputations and you know, foot disease.